Turning now to your community focus, we've been telling you about overcrowding in hospitals, and for kids, sometimes it's not just due to physical illness.
Here to talk about kids' mental health is Dr. Mitch Otu. He's an attending physician in the emergency department at Hasbro Children's and clinical director for the PACE clinic at Hasbro Children's. Thanks so much for being here.
Thank you guys for having me.
So, Doctor, just yesterday, our colleague Alexandra Leslie reported on some measures that the state is now taking to prevent overcrowding in Rhode Island hospitals. We know it's a bad season for RSV and the flu, but we also heard from health officials that mental health is impacting wait times. Is the same true for kids?
Absolutely. Yeah, we're seeing so much overcrowding right now these days. We see the seasonal pattern where during the summertime we do kind of get a bit of a lull in terms of kids coming to the emergency room and needing admission. And then school comes back around August, September, and we see this huge uptick all the way through the end of the school year into May or June.
So, you talk about the school impact, obviously a lot more germ spreading, but what is the back to school season? What kind of impact does that have on kids' mental health?
School tends to be a bit of a double-edged sword where there's a lot of support at school. I mean, we've got teachers, we've got school social workers, psychologists, guidance counselors, so many people who are there to really support these children. But then we're also dealing with the academic stress. We're talking about bullying. We're talking about all of these different things that are starting to weigh on kids. And so I think it's really all of that, the downsides of school that tend to have kids coming back. The other side too is that when we see kids coming in, it's oftentimes that they're talking to teachers and they're talking to social workers, and what's happening in those situations is that it's not necessarily that these problems had gone away during the summer. It's that they have those people to speak to, and they're sending them appropriately to the emergency room.
We're going into the holiday season. Kids will be spending some more time at home with family again. So what should parents be on the lookout for, and what can they do really to prevent their kid from ending up in the emergency department?
Yeah, really want to be looking for, any big changes in, how kids are acting. So like, are they sleeping more or less than they used to? Is there substance use that's going on? Are they isolating more? Are they not going out and doing the normal activities that they're used to? And so I think catching those things early on and talking to your kids about them and saying like, hey, I noticed this, I see this, I recognize this. I think those things are the most important things that parents can do. And then also just a lot of times it's a gut feeling. Parents, they know their kids, and I think that's often a lot of times what we go on when we're in the emergency room. We're meeting them for the first time and maybe we're talking for an hour or two, but we have parents who really know them and they're saying, yeah, something's just off. Maybe I can't put my finger on it and I can't say it exactly, but there's something that's off.
There's absolutely something to a parent's intuition.
Yeah.
Dr. Mitch Otu from Hasbro Children's Hospital, thank you so much for being with us. A really important topic, kids' mental health.
Thank you so much.